Good evening and welcome to DentistChannel.Online. I'm Dr. Aparna Pandya, and today with us we have Dr. Mahesh J. And it's actually a great honor and absolute pleasure to have you with us, sir. Dr. Mahesh J serves as a reader in the specialty of public health dentistry at Karpada Vinayaka Institute of Dental Sciences. He works extensively in promoting general health or oral health of the underserved population, and he shows immense knowledge and passion towards the quality of research protocol, designing and writing proposals, application, analyzing data, and publication. He completed his master's post-graduation at Bapuji Dental College and Hospital, Davangere, under Rajiv Gandhi University of Health Sciences, and his graduation at KGF Dental College and Hospital, Kollar. He holds his honor in the rank list of Rajiv Gandhi University of Health Sciences. He has 20 scientific publications to his credit in both international and national journals. He won Best Paper in National Conference, both postgraduate and staff category. And he works as a reviewer and member in editorial board for 2 international scientific journals, and also has been a guest lecturer or speaker at various institutions. He has done and helped in more than 250 statistical analysis for UG, PG, PhD, and medical students. It's actually I'm very honored to have you with us today, sir. Over to you.
Yeah, thank you. Yeah, thank you, Aparna. I'll be sharing my slide. Is it visible?
Yes, sir. Yes, it's visible.
Yeah. A very good evening to one and all present here. I would like to wish a happy National Public Dentistry Day for today. And I think Dr. Aparna has introduced me a lot. Let's get into the topic for today. That is upstream and downstream approach in public health. Think where we stand. Before getting into this session, I would like to tell you all a story. Imagine in a valley of river, there are a few persons who are drowning. Me, medical dentist, as a clinician, I just go near that shore, jump into that river, catch those people who are drowning, and then get back to the shore and admit them into the hospital. Then once again, when I come back to the shore, I see some more people who are drowning and coming. So what I do over here is, once again, I jump into that river, I catch hold of the person, I try to save them. And I do this routine. I do this again and again. Then suddenly I felt fatigued. Then what I do is, I just walk around the shore from this downstream to this upstream level. Then I could see there's a drown over here where people slide and then fall into that river. Then I could imagine why these people are flowing or draining in this water. So with this concept, we will move on to the next one, that is a similar case when it comes to oral health also. Here, what we actually do is serve the population or serve the patients individually, taking care of each and every individual treatment. But what is actually happening over here at the upstream level is the problems is still being created. Whatever the chocolate factories or sweets which is being generated, it is continuing, which is highly carcinogenic, and people fall into the drain. So this is what it happens. So with this concept, we will get into the topic, what is upstream and downstream approach in public health, and we will analyze ourselves where we stand. So the objectives for today's session will be to know what is upstream and downstream approach in public health, Is it really essential when it comes to public health? Where do we stand in serving the population, and whether it shows new avenues the way we think? So moving on to the first objective, and a very common definition which we have come across, what is health? And we all know health is a form of complete state of physical, mental, and social well-being, and not merely absence of any disease or infirmity. So this was given by WHO. And with this, if you speak about public health, we have various areas to cover, like the surveillance, monitoring, analysis, outbreaks. We speak about epidemics, how to prevent a disease, how to do health education and communication, what is risk and what is benefit, and then various concepts related to research. And for today's session, we will concentrate on, that is, what is health promotion. So what is this health promotion? Health promotion is a process of enabling people to increase control over and to improve their health. It is like giving the health of the people in people's hand and make sure that they improve in their strategies and get control over themselves in improving their health as well as oral health. So the first objective, that is, what is upstream and downstream approach? This is a very nice picture which has been given by Watt et al. And he emphasizes on the various steps, or what and all are the steps which has been taken, or you can also call it as the levels when it comes to what is upstream and downstream approach. We will divide these different levels into three, that is your downstream level, your midstream level, and your upstream level. So first is your downstream. What and all are the activities or things that we do, or the programs that we do when it comes to the downstream level? The first one is clinical prevention. This is the regular curative work that we do, specifically the primary prevention that we do, such as fluoride application, pit and fissure sealants, etc., etc. There is various others clinical prevention work we do, and we do it for individual patients in a clinical setup. The second one that we do is chair-side dental health education. So here we move one step ahead. That is, apart from providing the preventive treatment, we are giving certain amount of chair-side education so that the patient themselves analyze certain issues and be prepared with what has to be done in further. So this is the second level, that is your chair-side dental health education. The third one, which is most commonly done in public health dentistry, that is school dental health education. In the school dental education, we catch hold of the young buds and we make sure that we do even the curative treatment, preventive treatment, as well as health education in a complete package, and make sure that they all follow it and follow in such a way that they help the community. So moving on to the next one, that is media campaign. Whenever it comes to media campaign, the first thing that we come across is televisions, newspapers. There are various others media campaigns. Here in this media campaign, the advantage over here is it covers a larger amount of population, and whatever information or the let it be scientific information or even a form of a propaganda, both reaches to the people, and it reaches in such a way that people analyze and get to know what it is. So these four steps or the four levels which comes in your downstream, and this is what we usually do, and this is what we all have an idea. So we will move further to the midstream level, that is training of trainees. We call it as POT, training of other professional groups. So what we do is, we don't teach only the students, we make sure that even the teachers get educated. Why? Because we will be able to go and attend the school only once at a time. whereas the teachers are in a constant connect with the community or that group of people. So therefore, if the teachers or those training people are getting trained with the knowledge, so that comes under your midstream level of approach. The next one is your community development. So in this community development, the whole entire community comes into action, and this is how it works. First thing is they will have a common cause or a common problem. So let us imagine like the common problem in that community is dental caries. So what those people do over here is they have a meeting together. That is the stage where we call it as a corporation. Okay, they will have a meeting together and they will see what and all are their strengths and what and all are their weakness, whether they can afford foreign dentist who can take care of the problem, that is the dental caries, and they analyze with this and they check for something called as equity. Equity over here, making sure that each and every person in that community gets certain amount of equal distribution and inclusiveness. That shows that each and every individual knows about what is happening and he is included in the community development program. And then comes is your participation, making sure that all those people in that community organize a program and they invite the dentist. He could be one among the person in that same community itself, or he might be from another place, or he can be adopted. So all this thing comes in the form of a package, and this is called as community empowerment. So ultimately this cycle continues with various kinds of problems. The common cause or based on whatever the problem, the example that I gave is dental caries, and this entire process is called as community development, which comes under your midstream level of approach. The next one, that is your seventh one, is your healthy setting. So what is this healthy setting? This is an area where there's a small turnover. So far, whatever we were speaking in the downstream or the midstream level, here it is all based on the individual and the community based, whereas the government has not entered. Whereas when it comes to the healthy setting, it includes both non-governmental organization as well as governmental organization. So here we are including how the government also plays a role developing a healthy setting. So in this, I'll give you an example. Imagine there is a place where a group of people are suffering from severe fluorosis, dental fluorosis. So what the government and what the non-governmental people is, the non-governmental people, when they go for a camp, they just analyze what is the status over there, and they come to know that there is an increased prevalence of dental fluorosis. What immediately they do is they educate the people and they make sure that this converts from unmet need into a demand. Okay, first it was just an unmet need, then they make sure that they educate the people in such a way that the unmet need becomes a met need and it becomes a demand. So once it becomes a demand, then the governmental organization will come into play a role, and they create a kind of defluoridation setup in each and every primary health center. So this is an example for an healthy setting. These kind of healthy setting can be done in various kinds of industries by non-governmental or governmental, or an individual clinician, or by the industry itself. So this kind of an healthy setting, it comes under your upper part of your midstream approach. So here, this not only for the industries, it is even applicable in health promoting schools. We call it as HPS. So in this health promoting schools, it includes both the health education, and they involve the community leaders. They make sure that the school people go to the community and they reach out the people. And in such way, they create a healthy environment. They improve their skills as well as the public skills. And ultimately, whoever the dentist or whoever the organization which is coming to help them out, it will give a good and a complete package so that they can improve their community health. So this is all about your healthy setting. Moving on to the next one, which is starts from the upstream level. This is one of the step of the upstream level, that is fiscal measures. As soon as the word we come across with what is called as fiscal measures, we have to remember the term called as taxes. Here, the best example that I can give you is regarding tobacco. So here, just going and educating the people what is cancer, what are the ill effects of tobacco, and how to prevent by stopping tobacco, all those informations we give to the public, but still the generation of tobacco hasn't stopped. Still it further continues. So what we do is we emphasize more in taxation so that the people will come to know that yes, they spend beyond their money, and since they are spending more, okay, it is an opportunity for them to reduce the usage. So all these kinds of taxes which has been given comes under the physical measures, and it comes under the upstream level of approach. Moving on to the next one, that is legislation and regulation. So here, coming to that of your legislation and regulation, these are all the laws and the regular rules that we have, like not using tobacco in nearby schools, or the sale of tobacco has been not applicable in nearby schools, so that if you have a strict rule, the people will not purchase, or the school children or the public, whoever it is, they will not go and purchase in that area, and the entire area will be a tobacco free zone. So keeping in this mind, we have to make sure that there is more amount of rules and regulations, and it should be strictly followed. And this comes under your upstream level of approach. And the last one is your national and local policy initiatives. Here, we are not concentrating only on the national policy, we are even concentrating on the local policies. So moving on to the first thing, that is your local level policies. Here we are making sure that we encourage schools to become a part of health promoting schools, which we already saw in a healthy setting. And then develop oral health and nutrition policies in preschools and nursery, that is providing nutritious food. So we all know in government school they provide lunch, and it is not only in the form of lunch, it should be in the form of a nutritious lunch. So those kind of policies, everything will come under your national and local policy initiatives, and encourage sales of subsidized toothbrushes and toothpastes through community clinics. Why? Because if there is more amount of taxation or more amount of cost for the toothbrushes, people will refuse to use it. So the policy should include in such a way that all the preventive strategies that we take, it should be subsidized, so that people or the public can easily purchase it and can utilize it. Then they can even encourage nurseries and schools to provide subsidies on healthy snacks and drinks. Okay, so whatever the snacks or the drinks which has been provided in the nearby school, it should be made sure that it is healthy, and they should have a good cost of it. And we have to even concentrate on the areas like those adulterated ones, which the snacks what they distribute, or the fruits that they distribute nearby the schools and all. There should be strict rules that they and all are not being sold in front of school premises. And encourage the engagement of community action in the form of group, in the form of oral health projects or programs, and support development of local infant feeding policies, and ensure that oral health messages are being included. So if you go to a primary health center, we have various policies, we have various strategies how we handle the maternity, And in that area, we should also make sure that even oral health related messages are being included over there, so that even the people at the local level also gets the information and it reaches them. Encourage development of oral health policy in older people, residential homes and care centers. So we have to make sure that the elderly population, they are given certain amount of special care. So they are given certain amount of free treatment, which is usually done in case of private institution, but it is not there in the policy as such. So these kind of concentrating on this older people make sure that we reduce the amount of inequality when it comes to doing oral health care. Moving on to the support regulation on content and timing of television advertisement promoting children's food and drinks. So this usually we see when it comes to in related to tobacco use. We all often see it in all movies before the movie starts. They all tell that to not to use tobacco and drinking alcohol is injurious to health, etc., etc. In such cases, we have to even concentrate on promoting children's food, what and all food they have. And we have to make sure that the food labeling is being done in a proper way, and encourage greater availability of sugar-free pediatric medicines. Why? Because this majority of the school children, they are suffering from dental caries mainly because of sugar containing pediatric medicines, and this just because it has to be over consumed. And this is the reason why they, apart from their general health, they suffer from oral health. So this thing should be really concentrated and make sure that it is it works nationally, that we get sugar-free pediatric medicines, and support removal of VAT and other taxes on toothpaste and toothbrushes, because the actual price of a toothbrush is almost 40% of what we sell, the MRP. So the amount of taxes or whatever the distribution which is being done, it should be really reduced, not only for toothbrushes and toothpaste, to whatever the preventive strategies that we have. For all those things, the VAT has to be reduced. And support legislation on water fluoridation and defluoridation, which we already spoke about, which is also happening in the country. It is there in the regular policy. And support food and nutrition standards for school meals and other food and drinks that is sold near the schools. So these and all are the various national things that we come across. So here we have spoke about the downstream level, that is the clinical prevention, the SARE side, dental health education, and school dental health education, media campaign. All these things comes under your downstream level. And your training of other professionals, that is your TOT, training of trainees, your community development program, that is your community setting, and your healthy setting, that is all these three things will come under your midstream approach. And at your upstream, you have your taxes, that is your fiscal measures, your legislation and regulation, and your national and local policy initiative. With this, we complete our first objective, that is what is upstream and what is downstream. So there are certain amount of pros and cons that needs to be evaluated at each and every level. When it comes to your downstream, the target population is pretty less, because we treat each and every individual patients, and the cost on the resource that we need to utilize is more. Why? Because each and every preventive procedure might be a bit costly if you consider the entire group of population. And moving to the only advantage when it comes to your midstream level is that the target population is slightly improved. It is cost effective also. Why? Because when you do training of trainees and we create the healthy setting, it really reduces the amount of burden or the health problem which is there. And but the negative part or the cons over here is that there is no much amount of research evidence, and the implementation issue is still a question mark. Why? Because we have to first get trained, and then we are making sure the other people get trained, and you need a lot of interest and certain amount of financial support to do all kinds of implementation in a healthy setting. Then moving up with your upstream level, this creates a big impact. Why? Because if you do a national or and local policy, it gives a great improvement when it comes to reducing the inequalities. And if you see overall, each and every part, the target population is improved. You have certain amount of research also, which is evident telling the upstream approach is really good. The implementation issue, yes, it is yet to be implemented, and still the work has been going on, how to work exactly at the upstream level. But for overall, it is a good recommendation to concentrate more on the upstream level. With this, we'll move on to our second objective. Is it essential in public health? What is the need for us to know what is this downstream, what is this midstream, and what is this upstream? We can continue what we do in our institutes or what we do in our clinical practice. Is it really going to help us, or it is really going to be an essential part when it comes to public health? So this is the specialty when it comes to your upstream intervention. What we are actually doing is we are just mopping the floor. So we are standing over here and we are just cleaning the overflowing water. And the problems, if you see, it is there at the upstream level. So now it is left to us whether we have to still work in the downstream, just mopping the floor, or to concentrate on this upstream level and to just close this tap. So this is why we consider this upstream level intervention as an essential comes to public health and public health dentistry. How does it work? So there are various determinants of health. You can take there are n number of determinants like your age, your gender, the socio-economic status, the country, whether it is a developed country or whether it is a developing country. So all these are which determine the health as well as the oral health. So what we do over here is we concentrate on health promotion. Therefore, the risk factors as well as the risk condition gets reduced. How the risk factor gets reduced? By means of health education, that is the individual capacities. Whereas the risk condition, it gets reduced by means of healthy public policies, that is a proper environmental support. So keeping these two things into consideration, that is your health education as well as your healthy policy, ultimately what happens over here is it improves the health literacy. By means of health education, there is a conscious rising, there is a good amount of education and motivation to the people, and the skill building of that individual is increased. Ultimately, there is an increase in the health literacy. When it comes to a healthy environment by means of a policy, and coming to with that of good rules and regulation and guidelines, over here it creates a very good health literacy for the entire country. So with this proper health literacy, the areas where we'll come across is there is a good increase in health knowledge, the beliefs and practice of the people has been increased, and ultimately there is something called as community empowerment. Once there is community empowerment, ultimately the health behavior and the practice among the individual as well as the population gets improved, and ultimately the overall effort over here is to get an improved health outcome with reduced inequalities. And this is how this health promotion works when we concentrate on the upstream interventions. So with this, we will move on to the objective 3, that is, where do we stand in serving the population? I think with the objective 1 and objective 2, we all will got an idea where do we actually stand? So we are still standing in the downstream, to some extent in the midstream. And if we divide the people among us, we can see over here the dentist, they are in contact with the, they usually do clinical practice and they're attached to an institution. Whereas the public, yes, they go and approach the clinical practice, and they even uh, get, or they acquire their needs via the political people or the political policies what they have. And as a public and dentist, we should work on the institution as well as the political regulations. As a public and dentist, we have to concentrate in such a way that even the political policies, whatever it is there, it has to be improved and it has to be emphasized. And as a dentist, it has to be applied in your clinical practice and in your institution, and the public are in the receiving end. So coming to that of your objective 4, that is conclusion, does it show new avenues the way we think? Yes, definitely it shows new avenues, because each and every dentist, uh, irrespective of his specialty, everybody concentrates on the downstream level. But we have to show some light when it comes to the midstream and specifically to the upstream level, so that we improve in something called as health in the liver of life. So here, if you see, we all are concentrating in curative. Yes, we save people, we catch hold of people, we do all the things. But once we do something called as health promotion, we make sure that the people who fall in the drown, okay, they have been saved. So ultimately, the area that we have to be concentrating upon is at the upstream intervention. It doesn't mean that we have to concentrate less or in the downstream level. No, not at all. That is not the information or the awareness what we have to spread. We have to concentrate on all the levels, and we have to make sure that we concentrate more on the upstream level. So ultimately, the thing that we have to know is we need to build the ships of hope in the Valley of Floods. Yeah, these are my references. Any questions?
Thank you so much, sir, for this lovely presentation. It gave a new perspective and a new way of thinking about the topic. We never think about the fact that we are only helping those people who are coming to us. We can take it a step forward and help those who might need our help and isn't aware of it yet. So the presentation was so good. We do not have any questions as yet. So while we wait for questions, I would like to share our company presentation. So can you see my screen?
Yes.
One second.
No, no.
Can you see the screen now?
No, no, I'm not able to see the screen.
Okay. Now you're able to see?
Yeah.
So DentistChannel.Online is the first digital dental media, and we offer for both dental professionals as well as dental organizations variety of services like dental news, webinars, courses, events. All these are conducted very regularly. And for dental organizations as well, we host events, provide technical support, graphic designing, social media marketing, website development, participation certificate, event registration, consultation services, content writing and designing. And you can list your business and advertise with us. And we have conducted over 700 plus live dental webinars And after each webinar, all the participants will be receiving their participation certificate. We have conducted more than 25 dental workshops, and more than 400 national and international speakers are with us. There are more than 300 oral care videos under the hashtag Save the Tooth. We have also been in India Book of Records for maximum speakers. Maximum speakers participating in virtual dental program on oral health, oral implantology. And if you avail the Prime membership, you will have several benefits, like you will be able to get a personalized account with DentistChannel.Online, and you can access all the webinars. There'll be special discount for dental courses, and there'll be certificate by recognized institutions with CPD, CDE points. You can also have regular updates about the dental news and about dentistry. You can access scientific articles and recorded webinars, participate as a speaker, or publish public health awareness videos. So this will be the certificate which all the participants will be receiving at the end of the webinar. And if you join now, you can gain a Prime membership at $7.99 per year. And if you use the promo code AP100, you will get an assured discount. So these are our upcoming webinars. So, sir, thank you so much for this wonderful session. And
Thank you.
so, sir, how can a private practitioner use this concept in their day-to-day practice to serve the society?
Yeah. See, that is what we have to emphasize in the undergraduate course itself, that there are various levels in, that is the downstream and the midstream or the upstream level, and make sure that, okay, they have to get an awareness telling that there is level also. So there is a need for developing such kinds of policies also. So they can also give certain amount of ideas. It is not like only the public health dentist comes and he just designs what and all are the policies that is required. No, even the general dentist as well as other specialties should encourage in such kind of preventive programs. So in such way, I feel like the general dentist can also participate, and they have to be aware when it comes to what kind of a level it is.
Thank you so much, sir. Thank you so much, sir. And it was really wonderful to have you with us today. And let's conclude the session.